Hi everyone, my name is Hasib Sidiqi. I'm a haematologist from Fiona Stanley Hospital, and my area of interest is multiple myeloma and amyloidosis. I want to thank the Leukaemia Foundation for asking me to do this online presentation as a form of education material for patients with multiple myeloma and anyone else who is interested. So I thought today I'd talk a little bit about multiple myeloma, and I think what I'll do is spend about 20 to 30 minutes focusing on three main areas. I'll start off by speaking for 5 to 10 minutes on what myeloma is and how we diagnose it, and then I'll move on to talking about how myeloma is treated and some of maybe the more recent developments that you may have heard about. And then to finish the presentation, we'll touch on some of the common symptoms that people may experience and how we go about dealing with those. To help me out with the presentation, I've got a prop, which is a whiteboard marker and a whiteboard, and I'll be using it. I hope it comes across okay on the presentation. It'll just help me explain some of the things that I want to talk about. Myeloma, as you all may know, is a cancer of the plasma cells. The plasma cell is one of the cells of the immune system, and it lives in the bone marrow. So, if you can imagine this is a bone, and inside the bone we have the marrow space, and within here we have stem cells, and these cells produce the blood cells. So they produce the red blood cells, the white blood cells, and the platelets. And within that bone marrow, we also have plasma cells. And these plasma cells, are, like I said, are part of our immune system, and they normally produce immunoglobulins. And we all have immunoglobulin proteins, which have this Y-shaped structure, and there are different types of immunoglobulin proteins. There's IgG, IgA, and IgM. And there's IgD and IgE that are less common, but nevertheless, we all have these proteins, and we all have some amount of plasma cells in the bone marrow. It's usually in the order of about 2 to 5% in our bone marrow, and they're part of our immune system. These immunoglobulin proteins help us fight infections, particularly viral infections. Now, what happens in multiple myeloma is that something goes wrong in one of these cells, the plasma cells in the bone marrow, that allows those cells to start to grow in number and survive. And so what can happen is that the amount of these plasma cells in the bone marrow can increase, and as they increase, they can have a number of consequences. One of them is that they can take over the bone marrow and prevent the bone marrow from doing the normal stuff, producing red blood cells, white blood cells, and platelets. And when that happens, you can become anemic. That is one of the common manifestations of multiple myeloma. When patients present, we look at their hemoglobin, and often it is low. One of the other things that these cells can do is that they can start to eat away at the bone. And as they eat away at the bone, they can cause lytic bone lesions. And as they eat away at the bone, well, the bone is made up of calcium and phosphate. They can release that calcium into the circulation, and you can get a high calcium. And as these cell numbers increase, they start to secrete more and more of this protein, this immunoglobulin protein, which is the paraprotein or the monoclonal protein that we look for in the blood, and that is often the first sign that tells us someone might have multiple myeloma. And these cells can secrete the whole intact immunoglobulin protein or these little portions of it known as the light chains. And as you may have heard, we have two different types of light chains, the kappa light chains and the lambda light chains. And so these are the things we use to monitor how you are doing when we treat multiple myeloma. We look at the blood for the light chains and the monoclonal protein. And if these light chains that are secreted in the circulation start to get in high enough levels, they can actually cause kidney damage. And so that's another thing that patients with multiple myeloma can present with kidney failure. And so these are the common manifestations of multiple myeloma. To recap, it's essentially a cancer of the plasma cells in the bone marrow that start to grow and prevent the bone marrow from doing the normal things. They start to secrete these proteins that can also cause problems like kidney failure. And the way to diagnose it is a couple of things. So one of the things we can do is blood tests. So of course there are common blood tests that we do that help us diagnose this condition. And so when we do the blood tests, we specifically look at things like the kidney function, the hemoglobin, and the protein levels. And if we detect a paraprotein or a monoclonal protein, that's usually a signal that there may be some of these bad cells in the bone marrow causing an issue. And the light chains, which we talked about. And of course, we will look at your hemoglobin and the kidney function and the calcium that I mentioned before. But that doesn't give us a diagnosis. The second and important part of the establishing a diagnosis is to do a bone marrow biopsy, because we want to prove that there are these bad plasma cells that have started to grow in number. So a bone marrow biopsy is crucial to the diagnosis of multiple myeloma. And finally, we also do a scan of the bones, which is a skeletal survey, to see if there are any of these lesions where these plasma cells have eaten away at the bone. And that's important to do because sometimes that can be the source of symptoms like pain for patients. Other times there may be areas that we can, for example, target with therapies like radiotherapy, or if there's a particular spot in the bones that looks really weak because of the myeloma cells having sort of eaten away at it and caused this lytic lesion, we can intervene earlier to prevent fractures. So really, the critical things in diagnosis are the bone marrow biopsy, the blood tests, and the scan of the bones or the skeletal survey. And that's how we establish a diagnosis of multiple myeloma. So, that's sort of a little bit of background on what myeloma is and how we diagnose multiple myeloma. So the first thing to say is, as I mentioned, myeloma is a cancer of the plasma cells. And unfortunately, as of 2020, we don't have a single treatment that we can say we can give you and this will cure the multiple myeloma such that it will never ever cause a problem again. So it is still considered an incurable blood cancer, but it is very treatable. And I thought I would go through a little bit of the timeline and the history of multiple myeloma to give you a sense of what has happened over the years and a sense of the rapid sort of development in treatment of multiple myeloma that's occurred over the last 10 to 15 years. So if we kind of look back in history, what you'll notice is that the first cases of multiple myeloma were really described in the 1850s, about 150 years ago, or more, really. And at that stage, very little was known about it, besides the fact that it is a disease that causes destruction of the bones, and failure of the bone marrow. And very little in the way of treatment was really, um, you know, effective in treating this condition. And unfortunately, most people, you know, had some palliative treatments that didn't really benefit them and passed away from the disease. As we kind of head along towards the latter parts of the 1800s, the disease started to be a bit more formally recognized. So the term multiple myeloma we start to sort of see mentioned between the 1880s to the 1900s. So this is the first time that the term multiple myeloma was used. But again, we didn't really have a good understanding of the disease until much later. It wasn't until the sort of 1930s and till about the 1950s that we started to realize that this is really a bone marrow problem of the plasma cells. And again, at that time, besides the use of some radiotherapy, there wasn't really much in the way of treatment that worked for this condition. And it wasn't until the 1950s and 60s that we finally identified this protein in the blood. And subsequent to identifying this protein, we also figured out that there are different types of protein, and eventually figured out that there are light chains. And it was really in the sort of 1960s that there was finally some kind of a breakthrough in treatment for multiple myeloma. And the first drug that was really discovered in the 1960s was a drug called melphalan. This is a traditional chemotherapy drug that works by essentially trying to kill cells that are rapidly dividing. And we know that these myeloma cells in the bone marrow are dividing and growing. That's how they take over the bone marrow. And it was in the 1960s that the first clinical trials showed that people actually responded to treatment with this drug called melphalan. And it was given in tablet form at that point. And within the next sort of 20 years or so, an important discovery was that steroids, which if anyone has had treatment for multiple myeloma, you will realize that it's a very common therapy that's utilized in almost every single regimen that we use to treat myeloma. But it was in the 1980s that we discovered that actually steroids help treat patients with multiple myeloma. And it was in the late 1980s that people began using something called a stem cell transplant. And over the course of the next 2 decades, really the mainstay for treatment of multiple myeloma was to use traditional chemotherapy drugs. Melphalan was one of them, but there were other drugs such as cyclophosphamide or doxorubicin that were used to try and treat this condition, to use steroids, and to use a stem cell transplant. And a stem cell transplant really involves us being able to give a patient a very high dose of chemotherapy in a safe way. And that's designed to really try and wipe out as many of these myeloma cells from the bone marrow as possible. And really, it wasn't until the late 90s and early 2000s that we started to have any other treatments that came along. And the first drug that really was discovered that was found to be extremely useful in treating multiple myeloma was a drug called thalidomide, which some of you may have heard of. And this was really a drug that had a really bad rep because it was used as an antiemetic to help with morning sickness for pregnant women in the 1960s. And unfortunately, it led to really terrible congenital malformations and a whole, particularly associated with malformations of the limbs. And so, it really went out of favor after it was used as a morning sickness medication in the 1960s. But over the next 2 or 3 decades, people realized that it's actually very useful uh, in inhibiting blood vessel growth, and some researchers postulated that this may actually be useful in the treatment of cancer, and it was quite fortuitously used in a clinical trial in myeloma patients, and remarkably was found to work in about a third of patients. And that was groundbreaking. There hadn't really been any other form of treatment that had worked so well for patients with multiple myeloma until the discovery of thalidomide, like I said, in the late 90s and early 2000s. But really, since then, there has been a dramatic improvement in our ability to treat this condition. And what I can tell you is that between 2000 and 2010, really, the three drugs that were the mainstay were thalidomide, and a new drug that was discovered in that time was bortezomib, which again some of you may have heard, and then the third one was lenalidomide, which is really a cousin drug to thalidomide. It's basically a better version of thalidomide with a different side effect profile that's supposed to be more well tolerated. And really, those were the three drugs that were discovered and developed in that 10-year period and were being used in the treatment of multiple myeloma. But of course, in the background, there was a lot of research that was looking at a whole host of other agents for the treatment of multiple myeloma. And really, the next 10 years, that really sort of foretold what was going to come in the next 10 years. Because since the late 2000s till now, over the last sort of 10 to 15 years, we've had a number of other agents that are now used to treat multiple myeloma. And so there's another medication that you may have heard of called pomalidomide, which is again a third generation or a third cousin to thalidomide. You see that they all, thalidomide, lenalidomide, and pomalidomide all kind of share a similar name, and they all have a similar mechanism of action. But aside from pomalidomide, there's carfilzomib, daratumumab, and I can name at least 5 or 6 other medications that have been developed subsequently and have been shown to be effective in the treatment of multiple myeloma. And so you can see that for almost 150 years, there was very little progress in the treatment of multiple myeloma. But in the last 15 to 20 years, it's really, the research has been dramatic. The discovery of new agents that work for this condition have been dramatic. And that has really led to improvements in outcomes. Like I said, we know this condition is not curable, but it is very treatable. And the mainstay of treatment is combinations of these medications that I've talked about. If we look at sort of the average prognosis for patients with multiple myeloma in the late 90s, it was about 2 to 3 years. And over the next 10 to 15 years, we've made some really good progress, where now we say that the average prognosis is probably in the order of about 7 years. But there are many patients that we are seeing that continue on these treatments, well over 10 years, and so I think that's just a testament to how well these new medications work for this condition. That's not to say that the work is done. There's still a lot of research that is needed to continue improving therapies, and of course, always aiming for that elusive cure for this chronic, condition that continues to sort of relapse and require treatment. A couple of important principles to remember in terms of treating myeloma are that we use combinations of medications, okay? And probably the two most common combinations that are used in Australia are the first one being a combination of 3 drugs, and that is bortezomib, cyclophosphamide, and dexamethasone. Some of you may have heard the term cyborg used to describe this, or VCD. And the second one is a combination of 2 drugs, and that is lenalidomide and dexamethasone. These are the common regimens that are used to treat multiple myeloma for people who are newly diagnosed. Thereafter, there are a number of decisions that physicians and patients will make together, one of them being whether you should be considered for a stem cell transplant, and again, whether you are fit enough to undergo such a strenuous treatment really dictates whether that's a good option or not. And if you do have a stem cell transplant, after that transplant, there is also consideration of going on to what we call maintenance therapy, which helps try and keep the myeloma away for longer. For people who don't get a stem cell transplant, they will go on these combinations of drugs with the aim of putting the myeloma into remission. And you will continue to be monitored whilst you're on these medications. What we know about the myeloma is that unfortunately it does have this tendency to come back in the future. And when it does, we do have to retreat, and often we have to try and use other medications because the myeloma has figured out a way of getting around the medications that were tried in the first instance. And that's where those other drugs that I mentioned, like pomalidomide and carfilzomib and daratumumab, come into play. So I think the key thing is that treatment for multiple myeloma has improved significantly and continues to improve. And one of the things that you can expect is that you may have a treatment that works for a period of time, and when it stops working, you may have to try something else. And there are a number of different medications we can try and put the myeloma back into remission. Some of the common symptoms that patients experience with multiple myeloma. The first is fatigue. And fatigue can be due to a number of reasons. The myeloma itself can cause fatigue, and one of the main reasons why it does that is that it prevents your bone marrow from producing red cells, and so your hemoglobin drops, and you can be anemic because of that. And anemia can cause fatigue. The cancer itself causes a level of inflammation, so there are a lot of different proteins and cytokines that are secreted that cause inflammation in the body, and that itself can cause fatigue. So the myeloma can cause fatigue, the anemia can cause fatigue, and of course the medications we use to treat the myeloma can cause fatigue. And so this fatigue and loss of energy Unfortunately, the one thing I can say about it is that there isn't any specific treatment for it um, that works well, but there are ways of getting around it. The first thing to say is that the best way to treat fatigue that is caused by the myeloma is to control the myeloma itself. And what people often find is that when they're first diagnosed, if their hemoglobin is low and they're anemic, once we start treating you, those things tend to improve. And as the hemoglobin recovers, some of those symptoms that you may have had because of the anemia or the myeloma causing inflammation in the body should recover. One of the best things I can recommend is a good, healthy diet, plenty of fresh fruit and veg, and exercise. Exercise is extremely important. I think it really helps boost your energy levels. And really, in terms of how much or how little, it depends on the individual. And I think you should try and maintain a certain level of activity as much as possible to try and prevent you getting into the spiral of feeling tired and fatigued and lacking energy and then not doing anything, and that kind of makes the lack of energy and the fatigue even worse. So even if it's going for a walk every day or trying to get that 20 or 30 minutes of light exercise, I think it's really important in maintaining your physical strength, energy levels, and even your mental strength. The second thing is that the medications that we use, some of them can cause fatigue and lack of energy levels. And of course, we want to give you the best possible chance of controlling the myeloma. And so the medication is very important in trying to treat the myeloma, but we're always on the lookout for side effects from these medications. One of the medications that is particularly sort of well known to cause fatigue is this medication called lenalidomide or Revlimid, which is a tablet that you take once a day for 3 weeks on and 1 week off. And if that becomes particularly problematic, sometimes there is a role for dose reduction. Again, we balance that with the need for maintaining control of the multiple myeloma. So fatigue, unfortunately, is a common symptom, but one that doesn't often have a very easy solution. Like I said, my best recommendation is a healthy diet and as much exercise as you can manage. The second thing I want to talk about is pain. And again, pain can be for a number of reasons, but specifically, what we often see people presenting with is bone pain. So, bone pain is a manifestation of multiple myeloma, and as I said, it is because these myeloma cells in the bone marrow eat away at the bone and cause these lytic lesions. Managing that involves often using medications, so using simple things like Panadol. If that doesn't work, we can use stronger medications, even opioids. If there is a particular spot in the bones that is causing a lot of pain and symptoms, sometimes we can use radiotherapy to that particular spot, and that can help. And occasionally, people can develop these crush fractures in the vertebra because, again, the myeloma weakens the bone. And again, if none of these simple or more simple measures like analgesia and mobility and physiotherapy help with the pain, you can consider something called a vertebroplasty. Which involves essentially injecting a little bit of cement into the vertebral bones, that the weak vertebral bones or the ones that have fractured or been crushed, to try and help with pain relief, and sometimes that works. So I think this is something to always bring up and discuss with your doctor if you're having pain issues that you're not able to manage by simple medications such as Panadol. There are definitely stronger medications that we can use to keep people comfortable. And that's a very important part of managing the first symptom, which is fatigue. If you're in pain, you're not going to be able to exercise. You're going to lack a lot of energy. The fatigue levels and the lack of energy is going to get worse. So I think they kind of go hand in hand together in terms of if you manage to get the pain under control, some of these other symptoms like fatigue and lack of energy and tiredness can improve as well. The third thing I wanted to talk about is neuropathy. Neuropathy is really a side effect of the medications that we use to treat multiple myeloma. And the two most notorious medications to cause neuropathy are thalidomide and bortezomib. And in terms of managing the neuropathy, well, really, it's something you in the first instance have to keep an eye out for. If you start to develop numbness and tingling in the hands and feet or burning pain, then you need to let your physician know as soon as possible. We know that both these medications cause neuropathy, and the best way to avoid it progressing and getting worse is either stopping the medication or adjusting the dose. And so at the very early signs of neuropathy, often what we will do is adjust the dose of some of these medications to prevent it from getting worse. Outside of that, trying to manage it, if it has developed in terms of managing the pain symptoms that you can get, the burning and stinging pain, there are particular medications that work for neuropathic pain. Now, they unfortunately don't work for everyone, but some people do benefit a lot from these medications. You may have heard of medications like Lyrica or gabapentin or Endep. Those are all agents that can be used to try and help manage the pain that people may experience as a side effect from these medications. Like I said, the key thing is to keep an eye out for this. Let your physicians know so that we can prevent it from getting worse. Outside of that, the chemotherapies and the treatments that are used for multiple myeloma tend not to cause some of the more traditional side effects that are associated with chemotherapy, like profound nausea or vomiting. They can cause a little bit of gastrointestinal upset. Sometimes you can notice some alteration in your bowel habits, but as a general rule, they are fairly well tolerated. To finish off, I just want to mention something about the immune system, because I think that is something on everyone's mind at the moment, particularly with the recent issues with the coronavirus. What we know is that myeloma suppresses your immune system. So your immune system is suppressed because of the myeloma and because of the medications we use to treat the myeloma. And so I think this is something important to be aware of. To start off with, there are certain medications we may put you on to try and help prevent complications occurring. For example, to prevent reactivation of certain viruses, particularly shingles, we put patients on something called valacyclovir. And if you're on bortezomib, you'll also be on valacyclovir to try and help prevent that. So that's just to try and help prevent some of the immune complications that you can experience. And some patients may also be familiar with a medication called Bactrim to help prevent chest infections. And sometimes we also use other antibiotics to help prevent infections in patients who are receiving treatment for multiple myeloma. Some of that depends on your particular circumstance and what type of treatment you are getting. But I think it's important to be aware that your immune system may not be functioning like everyone else's. And so you do have to take some precautions and ensure that, for example, if you develop a fever or start to feel sick and unwell, you should be seen by your physician as soon as possible, because we have to take some of those things more seriously, given we know that the immune system may not be functioning at 100%. And if we find that really you've had treatment for multiple myeloma, or you've had it for some period of time and you're getting recurrent infections, and we check to look at the level of the immune system and find that the immune system really isn't working at a great level, we can sometimes consider augmenting your immune system by giving you infusions of something called immunoglobulin. And that's usually given as an IV infusion every month. So these are all the things that we use to try and help your immune system whilst you're being treated for multiple myeloma. I think the important thing is to try and be vigilant yourself, particularly in this current climate with concerns about coronavirus, trying to stay away from people who are unwell, from big crowds. And of course, if you feel any symptoms or feel unwell or have temperatures, you need to be seen sooner rather than later.